South Carolina ranks among the worst in states in the nation for maternal mortality. And a new report from the Institute of Medicine and Public Health found that Black women in South Carolina are dying from pregnancy-related complications at nearly twice the rate of white women. Rose Sims founded the Black Maternal Health Collective after losing 2 of her friends to childbirth complications. Thank you so much for joining us today.
Of course.
Well, let's talk about what initiatives South Carolina currently has in place to improve health outcomes in rural and also minority communities.
Right, so just wrapped up the South Carolina Maternal Task Force initiative, and there was a big press release at South Carolina ETV on things that will happen in the state for the next 10 years. And one of them has been having access to accessibility for rural counties. So having mobile units to come out to be able to provide just basic prenatal care is a huge thing. We realize that 15 counties in the state don't have obstetric care or OBGYN care for mothers to get to and from their appointments for prenatal. So mobile care will allow that accessibility, and we're hoping that it will expand for South Carolina. Another initiative is wraparound care. We realize that providers can't do all of the work when it comes for caring for mom and baby. So we have to look at options like community-based doulas, providers that are in the community, such as mental health counselors, who will be able to provide that extra support that moms need to get through pregnancy, conception, pregnancy, and postpartum. Most of the women are having challenges and difficulties after birth. So that day 1 after up until 365 days is where we find most complications that happen. So an entire ecosystem of providers and support and professionals are needed, and the community is a huge part of that as well.
Yeah, because once you bring that baby home, that is when the work starts.
The work does
That's
start.
what I've been told. I'm auntie right here. I'm proud auntie, so that's what I've seen. You know, a lot of times we hear these numbers and these statistics, and it's very easy for it to go in one ear and out the other. Can you really paint the picture for us of just how dire the situation is here in South Carolina?
So I like to paint the picture to say, like, if you really think about it, you probably know at least 1 or 2 people that have been impacted by either dying from pregnancy or either having a complication, which is the morbidity piece. So we hear mortality and morbidity, and a lot of times we overshadow morbidity, but morbidity are conditions that moms live with after giving birth. So it could be things like heart disease, from suffering from preeclampsia. So these are things that are going to require more additional support after the baby has been born. So if you think about your friends, line 10 of them up, at least 2 of them have had either mortality or morbidity experience. And that hits home, like thinking about 2 of your friends. So Black women are 2 to 3 times more likely to be impacted more than our counterparts. And that is significant when you think about numbers. 2 to 3 times more is very significant.
Let's talk about what's happening this weekend. What event are you putting together?
So Lighthouse Christ for Ministries is just the ministry that I attend and my family, which is in Camden, South Carolina. So it's in Kershaw County. And we realize that Kershaw County is one of those rural areas that lack obstetric care. So one of the things that we're doing in combination and collaboration with South Carolina State is doing Move for Moms. We realize that nutrition and being active is a huge part of decreasing things that come up either in childbirthing phases or afterwards. So we're allowing them space to come in and do line dances. We know that boots on the ground is like the thing right now.
Yes.
So we're doing a boots on the ground session with Justin Rufus, who's the minister of music at our church. And we're also having what we call like your passport experience. So we have 4 different rooms set up with different opportunities to listen to 15-minute presentations on things like childcare, maternal health resources, spiritual wellness. Like, it's a huge part to be well, not just physically, but emotionally and spiritually when you're going through the birthing process. So they'll get an opportunity to do that. We also have a maternal health closet, so moms can come in and get car seats and diapers and infant formula if they need it, but supplies to really get them kicked and started on their journey of maternal health.
Thank you so much for joining us. I love what she's doing.
Yes, absolutely. It is critical, and thank you for spreading this message, because more people need to understand that this is a problem, but there are solutions.
Absolutely, absolutely. Thank you guys for having me.
All right, well, stay with